All right, so we are on part 2 lecture video for chapter 12 in your Blue Pharmacy Practice for Technicians book. So we're picking up on slide 20 and talking about sterilization to eliminate microorganisms. So asepsis is the absence of pathogenic microorganisms. This happens when aseptic technique is followed when preparing CSPs or compounded sterile products. Asepsis includes the hand washing and garbing and gloving process. This is something that we're going to do when we come back on campus because obviously we don't have the ability to do that online, but it will be a process from beginning to end on how to properly sterile gown and glove. Sterility is the absence of all microorganisms, so sterilization destroys even the most resistant microbes. So there's different types of methods for sterilization. So you have heat, which uses an autoclave to boil a product. In this case, it's used for instruments like surgical instruments, solutions, and powders. The advantage is it's available, effective, it's economical, and it's also easily controlled. Disadvantage is the space requirements. The autoclaves are pretty large equipment. They're expensive, so that's another disadvantage. And then it does take time to train personnel in how to use the autoclaves. Dry heat uses hot, dry air at a temperature of 170 degrees Celsius for nearly 2 hours. So there's a specific time limit, so 2 hours at 170 degrees Celsius, which we know that will be a very high number in Fahrenheit. So it's used for disposal of contaminated objects. Disadvantage is it's impractical for many substances. It takes longer than moist heat. So dry heat like that at that temperature could be damaging to a lot of things. Mechanical uses filtration through a screen-like material which blocks the organisms. So this is good for heat-sensitive materials, but the disadvantage is it's not applicable for sterilizing objects or surfaces. Gas. So for example, ethylene oxide, an advantage of this is it's used for objects that can be destroyed by heat. The disadvantage is it does require special equipment and aeration of the materials, and it is highly flammable. So that's one thing that they have to take into consideration because of the highly flammable issue surrounding the gas. There's very strict storage requirements, not only from the companies but also OSHA. So chemical, so uses like iodine, IPA, which is isopropyl alcohol, or bleach as a surface disinfectant. It's used topically and it can be used on inanimate objects. So again, we can put it on countertops, tables, doorknobs, cabinet doors, cabinet handles, that type of thing. Its disadvantage is it's obviously not applicable to liquids or powders. So the need for sterile drug compounding. So drugs administered intravenously must be done so in a sterile environment. They must be prepared sterilely to prevent serious infection. The thing is, if you think about it at IV, that medication is going directly into a vein. Once that happens, we cannot take it back, okay? So we have to be very careful and make sure that we're doing everything we can to make sure and ensure that we're properly preparing these in a sterile environment. So there's different types of compounded sterile preparations, or CSPs. So we have large volume parenteral preparations, which are larger than 250 milliliters. You have small volume parenteral preparations. So parenteral means injection. So it's going into the skin, it's going into the vein. So IV, IM, or intramuscular, intravenous, intramuscular, intrathecal, anything that's injected into the skin is considered a parenteral preparation. Parenteral nutrition, known as PN, syringe injection, so IV push, intramuscular, subcutaneous, intrathecal, Non-injected sterile preparations, so these would be like your eye drops, okay, ophthalmic drops. Sterile hazardous drugs such as chemotherapy agents, and then sterile nuclear drugs such as irradiated iodine. So the USP, we've talked about that, the United States Pharmacopoeia, they set standards for different types of pharmacy practice and skills and preparation of drugs. So USP Chapter 797 is specific to sterile compounding. It sets the standards for sterile compounding. These standards focus on the sterility and stability of compounded sterile products. So the difference between sterility and stability. So sterility refers to the CSP, or the compounded sterile product, being free of microorganisms. Stability refers to the chemical and physical characteristics, so such as pH, degradation of the ingredients you're putting into the bag, precipitation, or any other unexpected color changes. USP Chapter 797 pertains to all personnel in all practice settings that prepare, store, and handle CSPs, or compounded sterile products. So donning and garbing should never occur at the same time in the same place. So what that means is if you have technicians going into the IV room that are donning, which means they're putting on, donning and garbing, they're putting on their hairnet, their shoes, their mask, the gown, all of that should not happen when you have in the same place and at the same time as others that are coming out and degarbing, so taking everything off. So continuing on with the USP Chapter 797 standards, so contamination risk levels of the compounded sterile products. That's based on the probability of microbial, chemical, or physical contamination. They are classified as low, medium, and high risk. Each compounding facility must have written standard operating procedures that meet the USP 797 standards and guidelines. The beyond use date, known as BUD, BUD, is the date and time beyond which a compounded sterile product should not be used. So when we compound these sterile products, if we're making an IV, if we're making an ophthalmic drop or an eye drop, we have changed or taken the drug from its original state. So that expiration date on that vial is no longer valid. We've added it to another solution. We've added it to many other solutions. And so from there, the beyond use date is determined because it has been changed from its original form. And again, guidelines vary on this depending on the risk level. So as an IV technician, so if this is something that you're interested in doing, you're going to learn how to do this anyway in class, but not everybody is comfortable moving on and working in a hospital or long-term care setting. So hospitals have IV technicians, long-term care pharmacies, home infusion pharmacies, chemotherapy specific pharmacies have IV technicians. So if you're wanting to move forward in that, then one of the things that you're going to have to show and continue to show competency in are things like hand washing, hygiene, and garbing, your aseptic manipulation, which is a specific way that we actually draw the medication out of a vial and put it into a bag. Proper clean room behavior, obviously not eating and drinking in a clean room, making sure you're properly donned and garbed, measuring and mixing, use of equipment and tools within the IV rooms or in your sterile environment, proper use of your PECs, which is your large hoods that we call hoods that allow you to compound inside of those. Understanding the direction of an airflow within the PEC. So there's two different types of what we call IV hoods. There's a vertical hood and there's a horizontal hood. In a horizontal hood, your airflow is going to be moving from back to front. So the airflow is going to be coming from the back of the machine or the hood towards you, so from back to front. In a vertical hood, your airflow, okay, where your screen where your HEPA filter is on the top, so your airflow is coming from top to bottom. Potential impact of personnel activities, documentation of the compounding process, cleaning and disinfection. So, we're required to clean these IV rooms. When I worked in the IV room, that was one of my specialties. When I worked at the hospital in New Mexico, I worked in the IV room very, very frequently, and we had to clean the IV hoods before and after every shift. We're expected to wipe down the counters all of the time or daily, multiple times a day. Things like the floor need to be wiped down daily. Ceilings and walls can be done monthly, so it's just different expectations. And then also you want to have an understanding of the different methods of sterilization. So compounded sterile products must be compounded in a clean room, the sterile compounding facility. So the floor, ceilings, and walls are actually sealed to prevent microbial contamination. A high efficiency particulate airflow known as a HEPA filter, HEPA, H-E-P-A, minimizes airborne contamination. These filters need to be recertified every 6 months. Air quality adheres to the International Organization for Standardization, known as ISO classifications. Those ISO classifications are classified as 1 through 9, where an ISO 1 is the cleanest. Direct compounding area, or the bench, or the environment, the hood that you're working in, must be an ISO 5 or ISO 5. So the clean room, the ante-room, this is where personnel will hand wash, garb, gather your supplies, perform your calculations, wipe down your supplies, and label your compounded sterile products. So we want to make sure that we're wiping everything down inside the ante-room before we are bringing that into the clean room. Items present, so a small number of items including your syringes and needles and vials. There's no cardboard permitted in this area at all. And your air quality specification, or your ISO class requirement for an ante-room, is an ISO class 8. Your buffer room, known as the IV room or the clean room, this is the room for compounding sterile products. It has non-porous walls and ceiling tiles. It is a lower temperature. It does get very cold in there. It does have low humidity, and it is a positive pressure environment. So items present in here would be your laminar airflow hoods, or your PECs. And this environment, the ISO or ISO requirement for this environment is a class 7. So your primary engineering controls, known as your PECs, these are ventilated workbenches, or what we call hoods, in which the sterile compounding occurs. An ISO class 5 air is maintained within the HEPA filter system. Your secondary engineering controls, the ventilation and the HEPA systems, are built into the clean room's heating and ventilation systems. The positive pressure pushes the filtered air into the clean room. A unidirectional airflow sweeps the particles away from the compounding area. So again, that's where that airflow is maintained. We're keeping everything out. Aseptic technique, so as sterile compounding personnel, so access to the clean room is restricted to those who are trained on how to prepare compounded sterile products. You're not allowed to wear any cosmetics, so no makeup, no perfume, no hairspray, no artificial nails or nail polish is permitted for technicians that are going to be compounding sterile products. We were very strict on this, so no makeup at all, no foundation, no mascara, no eyeshadow, anything like that. Obviously the artificial nails, no hairspray because the hairspray risks for flaking, and then no perfume. Those with certain medical conditions such as respiratory infections, any weeping sores, rashes, and even a sunburn, you should not work in the clean room. Absolutely no food or drink beverages, no chewing gum, and no horseplay is allowed inside these areas. So that got us to slide 31. We're going to go ahead and stop here. Make sure that you're reading through the chapters. I put the assigned reading right there on the front of the folder for the day. Make sure you're reviewing this and watching all of your lecture videos, and then you're reviewing your PowerPoint.